Hello, this is Lance Johnson. I want to talk about the face mask because I know Steve Sisolak, he wanted to enforce a mask rule for everybody in the state, but it's a picture of Jeanette Gurula um, of LA adjusted her sunglasses this past Sunday on her daughter Nadia Salcero, 4 years old, outside Caesar Palace. This a this little girl look like she's grown. Don't even like a little girl, but I guess looks can be deceiving. But face coverings still get official backing, but health experts lack full agreement. Yeah, the signs for masks still revealed as how you say, divisive, as divisive as any question in today's polarized climate is one sounds so simple. Should everybody wear masks in public to curb the spread of the CV-19? Those who support wearing a mask cite recommendations from public health officials as well as common sense. Who, after all, wants to be sneered on? Those who don't favor universal mask wearing note that recommendations should have been confusing and inconsistent. The question whether cloth mask offers much better beyond making the wearer feel smug. Let's go to this picture and we'll come back to that. Okay, behind the mask, the World Health Organization, a Center of Disease Control Prevention, offers different guidance on how and when the public should wear face masks in public settings. World Health Organization cloth masks. When physical distancing is difficult, such on public transportation, in stores, or other confined or crowded environments, such surgical masks. People 60 years or older or a conditions in situations where physical distance is not possible. N95 masks not recommended. Face shields not recommended. Okay, this is from the World Health Organization. The Centers for Disease Control and Prevention. Cloth masks. People older than 2 in public settings where social distance or other measures are difficult to maintain. Surgical masks not recommended. N95 masks not recommended. Face shields not recommended. So both two organizations, they differ in where masks should be worn. But I mean I just know that why this is going on. If you're close to somebody who is not your family, you should wear a mask. Like if you're out in public, close people, you should wear a mask. People who you don't know, you should wear a mask. Like I know my job, I be close to people, we talking and everything. We wear a mask. Like if we're like away from the customer and we want to like take a breath and everything, we wear a mask. But I mean, if I'm gonna catch coronavirus, at work, we all gonna catch it. But it's not gonna do about it. But the mask, it's okay to wear it if it's not hot. But if it's hot and everything, that mask can be hell. And we have to wear the mask all the time because customers can complain. And plus, it's a law where if you working, if you have a job and stuff. I guess customer service, whatever, you have to wear a mask. Excuse me, I'm still yawning. Sorry, but it's just that if you're like close to people and stuff and you don't know nothing about them, you should wear a mask. But But I mean, you should protect yourself. You know, if nobody don't want to wear a mask, as long as you wear a mask, you're fine. I guess you're protecting yourself. But I mean, I just like if I want to take a breather, I don't wear a mask. But if I feel the need to wear a mask, I wear it. But um, although people come down strongly on one side and or another, whether science or the guidance of masks is so clear cut, debate has raged in recent days on Governor Center asked a member of his medical advisory team Friday to evaluate whether the public should be required to wear masks in public, as now the case in California. Nevada state requires masks in many working settings, including restaurants, offices, stores, and for all employees who interact with the public, but the state does not require them for customers who want session the gaming board on Wednesday, maintaining gamblers or playing masks, wear masks, otherwise state and country. Officials have strongly encouraged and not compelled the public to wear masks. We support the following recommendations and Centers for Disease Control and Prevention for World Health Organization, said Jennifer Sizemore, spokesman for the Southern Nevada Health District. The recommendation is for the public to wear cloth face coverings. Yes, even the CDC and who the U.S. and the International Public Health Agency respectively don't fully see eye to eye whether the public should wear a mask. CDC, Center for Disease Control, and WHO, World Health Organization. That's who that is. Who I was just talking about, on how they agree with the mask. Okay, the World Health Organization, an agency for the United Nations responsible for international public health, on June 5th issued new guidance regarding masks. Updated guidance state in part many countries have recommended use of fabric masks, face coverings for the general public at the present time. The widespread use of masks by health people in the community setting is not yet supported by high quality or direct science evidence, and there are potential benefits and harms to consider. But taking into account studies of transmission of the CV-19 by infected people without symptoms, as well as observational evidence for use of masks on the public in several countries, the WHO now advises the areas where the virus is spreading. Governments should be encouraged the general public to wear masks in specific situations and says that part of the comprehensive approach to suppress the SARS CoV-2 novel CV transmission. A study for WHO in response to questions for the review journal laid out these specific situations in areas where the virus, people over 60 years or over, or those with undefined conditions should wear a surgical mask. A situation where physical distancing is not possible, the statement said. Governments should encourage the public to wear a cloth mask where the widespread transmission and physical distancing is difficult, such as public transportation in stores or other confined or crowded environments. The statement said, in updated guides, the international organization lists both pros and cons of wearing masks in states where the likely advantage of the use of masks by healthy people, including reduced potential risks from infected persons before they develop symptoms and reduce potential stigmatizations of individuals wearing masks to prevent infections. Others. Disadvantages include potential increase of self-contained due to the manipulation of face masks and subsequently touching eyes with contaminated hands, and potential self-contamination that can occur if non-medical masks are not changed when wet or soiled, creating favorable conditions for microorganisms to amplify. The advocated guidance stems from a WHO funded review data from 172 observation studies published in the Lancet Medical Journals this month, which found that wearing masks can reduce the risk of CV-19 infection. The finding comes with a cabinet that had a lower level of certainty, in part because they have yet to recognize controlled trials of mask effectiveness. Center for Disease Control. As part of CV-19 recommendation that people 2 or older wear cloth masks in public settings where the social distancing measures are difficult to maintain. The CV emphasizes that wearing cloth masks primarily will protect people who come in from wearing in contact. Let me pull this closer because I'm just reading. I'm not even paying attention to where the phone is going. Infected people can spread the virus before they develop symptoms, and cloth face coverings provide what we call source control to reduce spread from the wearer's coughs or exhale breath. Christian Norlund has spoken before the CDC said in an email. This is boring, but it has to be said. At the start of the pandemic, the CDC said there was no need for health members of the public to wear masks. It is advised that surgical masks or a heavy-duty N95 mask were in short supply around the globe. It should be reserved for medical personnel, but some evidence began to show that the disease could be spread by people infected by the virus who either never developed symptoms or before they were symptomatic. CDC changed course and recommended that the public wear cloth masks to avoid infecting others. Data are limited on the effectiveness of cloth mask covers in respect to those come primarily from laboratory studies. Norlund said, "We know that future studies are needed to measure the filter efficiency and extent to which face coverings reduce SARS-CoV-2 transmission for some people who is infected, especially those who are asymptomatic or pre-symptomatic." Brian Lavis, a member of the government medical advisory team, said there can be no waiting for future studies. That's evidence we'll love to have, but it takes time to do those studies, said Labus, assistant at UNV School of Public Health. In the meantime, we're still dealing with an outbreak. Wearing a mask is a basic way to prevent disease transmission. He said, "We're doing it for the same reason you cover your mouth when you cough or sneeze." Lavis would like to see masks mandated for the public, but meanwhile, I'm not wearing a stupid mask for me. I'm wearing it for you. He said, "If I'm infected right now and I don't know it, I could put this mask on to keep you from getting sick. I'm going to do it." But yeah, if you're in the public, you should wear a mask, to have respect for other people, because I know if I'm at, I ain't gonna say Walmart. If I'm at Target or if I'm at Costco and I'm too close to somebody, they gonna tell me to back up. Because I know, like, in places where a lot of people, people don't always social distance themselves, so wearing a mask for safety to protect yourself is always good. I don't know why I keep yawning, but I need coffee or something. But and drinking like hot fluids, it does open your respiratory system, so that does help. If you do have the virus, it does help. Or you try to prevent the virus, like hot fluids will help. But anyway, thanks for listening. Like, share, subscribe. Hit the bell notifications, comment below. I didn't say my name. My name is Tommy Gill, known as Lance Johns. Channel Lance Johnson driving Las Vegas and more, baby. But be safe. Wash your hands. Sanitize your hands. Be clean. Wear a mask in public. Social distancing. Don't be a hoarder. Think about other people. You see something, say something. Don't be afraid to speak out. And always thank you and have a good day. Be safe. Be blessed. And just you feel sick, stay at home. Go to the hospital. You have to go to the hospital. It seems like I'm trying to lose my voice, like Stephen Campbell not leaving Las Vegas. But get better, Stephen Campbell. I don't think I'm losing my voice. I just woke up not too long ago. So thanks for listening. Have a good night. Bye.